All right, go ahead.
Okay, so our presentation is on the U.S. Department of Health and Human Services. Next slide. So an overview of HHS, the mission of the U.S. Department of Health and Human Services is to enhance the health and well-being of Americans by providing for effective health and human services and by fostering sound, sustained advances in the sciences underlying medicine, public health, and social services. The U.S. Department of Health and Human Services is the U.S. government's principal agency for protecting the health of all Americans and providing essential human services, especially for those who are least able to help themselves. And so with these responsibilities, they're responsible for about a quarter of all federal outlays, which is just an amount of money spent on something. And they administer the most grant dollars than any other or all other federal agencies combined. So how the department manages these programs is they team up with a lot of other programs as well. So next slide, please. So we were asked to go over the functions and principal roles of HHS, and there are a lot of them, a lot. So to go through the bullet points, they provide healthcare coverage to more than 100 million people through Medicare, Medicaid, and the Children's Health Insurance Program and the health insurance marketplace. They promote patient safety and healthcare quality in healthcare settings and by healthcare providers by assuring the safety, effectiveness, quality, and security of foods, drugs, vaccines, and medical devices. They seek to eliminate disparities in health as well as healthcare access and quality and protect vulnerable individuals and communities from poor health, public health, and human services outcomes. They conduct health and public health and social science research, and with that, they're also able to provide a lot of jobs to people. They also seek to improve health information technology to help other people. Next slide, please. They improve maternal and infant health, promote the safety, well-being, and healthy development of children and youth, and support young people's successful transition to adulthood. They promote economic and social well-being for individuals, families, and communities, including seniors and individuals with disabilities. Support wellness efforts across the lifespan from protecting mental health to providing risky behaviors such as tobacco use and substance abuse to promoting better nutrition and physical activity. They prevent and manage impacts of infectious disease and chronic diseases and conditions, including the top causes of disease, disability, and death. They prepare Americans for, protect Americans from, and provide comprehensive responses to health, safety, and security threats, both foreign and domestic, whether natural or man-made. And they serve as responsible stewards for the public's investment. Next slide, please. We were also asked to go over CMS, Centers for Medicare and Medicaid Services, just a little bit. So this CMS is part of the Department of Health and Human Services. So when you think of Medicare, think of it as a health insurance policy offered for seniors 65 and over, along with people under 65 with certain disabilities. And think of Medicaid as a public assistance program for needy Americans of all ages based largely on financial need. So you care for the elderly and aid the poor. Next slide, please.
Okay. My name is Kelsey, and I will make sure to go over the organizational structure with you guys. So, as mentioned before, the United States Health and Human Services do follow a mission statement, and it is accomplished through the outcomes that these programs provide. These programs are run by HHS agencies and offices, and I will begin to explain what those are in a little bit. But it's important to keep in mind that these different agencies and offices are the foundation of the department, and basically each of them contribute separate responsibilities that are significant in that matter. So I will first explain the Office of the Secretary and Staff Divisions. So the primary goal of the Office and Secretary and Staff Divisions is to provide leadership, direction, and policy in the department. They have a role of overseeing the organization and its programs and activities, and they do this along with the HHS Chief Policy Officer and General Manager, who are basically in charge of the organization as well. Next up is the 11 operating divisions. So there are 11 of them, and that includes 8 agencies in the U.S. Public Health Service and 3 service agencies. These different divisions administer these programs and conduct important research that can benefit in protecting and serving all citizens of America. And lastly is the 10 regional offices. They basically directly serve state and local organizations. Each different regional office has a regional director who has the responsibility to lead each office. And by doing so, the department will be able to maintain close contact with state, local, and tribal partners, and they'll be able to fulfill specific needs that are within the community or within like individuals who work with the HHS programs. Next slide. So this is the organizational chart. It's basically like all the agencies and offices that I explained before. That it includes the 11 operating divisions, the 10 regional offices, and up top is the secretary, deputies, secretary, and chief of staff, which is basically the chief of policy. So if you are interested in getting a closer look at what each office or agency is in charge of doing and what specific role they need to do within a community, you can go ahead and look that up on hhs.org, which is where that will provide that kind of information, and along with the information that is included within this presentation. So if you would like a deeper look at it, then I suggest to go and look in that website because it helps a lot. Next slide.
Sorry. So for HHS leadership, it is divided, but the 2 top ones would be the secretary and the deputy secretary. So the leadership has many important people that play important roles, and they all aid each other. And these leaders are selected by the government, which is important to remember. And it's divided among Office of the Secretary leaders, operating division leaders, and several offices. Next slide. So as I said earlier, the 2 highest positions are the secretary and the deputy secretary. And this picture to the right is a picture of Thomas E. Price, who is the current HHS secretary. And then the deputy secretary is actually not currently listed on hhs.org. But upon further research, I found that Eric D. Hargan of Illinois has been nominated by President Trump, and so we can anticipate him to fill this position in the future. Next slide. Okay, and to the right here is the Inspector General, Daniel R. Levinson. And so you have the Office of Inspector General, and their mission is to promote economy, efficiency,
and effectiveness through elimination of waste, abuse, and fraud. And then you have several offices which help in this. And so one office listed below is the IOIG, which is the immediate office of the Inspector General. And they are responsible for meeting the OIG mission, as well as promoting effective OIG internal quality assessments. Next slide. Okay, and so these are a whole bunch of important offices which are actually listed in one of our lesson 8 readings. I thought that I would sum them up really quick. So you have the OMP, which is the Office of Management and Policy, and their mission is to support some mission support services to the Inspector General. And they're also over budgeting policies, and they manage information technology resources. And then you have the OEI, which is Office of Evaluation and Inspections, excuse me. And they're basically just over evaluations. And then you also have the OCIG, which is the Office of Counsel to the Inspector General. And they provide all legal services and advice to the Inspector General. And then there's the OAS, which is the Office of Audit Services. And they provide policy direction for and oversee comprehensive audits of HHS programs, operations, etc. And then you have the OI, which is the Office of Investigations, and they conduct investigative activities related to allegations of fraud, waste, abuse, or mismanagement in HHS programs. So that basically sums up those offices and what their missions are. Next slide. And then these are just our references. So that sums up our presentation.
All right. Good deal. Thank you very much. I will go slightly easy on you with the question and answer. If you want to all mind, go ahead and unmuting yourselves. I guess what I would like to do is let's go ahead and open it up. And what's one thing that you learned or that stood out to you as you were doing preparing for this presentation specific that you didn't know before?
One thing that I didn't know is just how much the HHS did. It's just kind of incredible to think about everything that they cover to improve the health of Americans. Because, I mean, that's a really big task to take on. But then all of the other agencies that go under them to help with that.
I agree with what she said. Just there is so much, and there's so many different departments and offices and everything to accomplish their goal. I just thought that was interesting to learn about.
Yeah, but specifically within like the organization itself, like each different agency has a specific mission. The entire department has a mission for the entire thing within like all the agencies and programs that they develop. But what stood out to me is that each agency and office also has a mission that they follow as well, which I thought was pretty interesting, so that they can fulfill all the needs of the community that is required.
That's a good point. Yeah, thank you, ladies, for your presentation. Great job. I always enjoy this presentation, mainly because my background is more in healthcare administration, working within hospitals or clinics or whatever else. And I do realize that a lot of people's majors is in health services, basically, public health as well. And this topic, I think, does well in covering the general broad idea of that whole thing. And so it's always interesting to me because I also learn things every single time I watch one of these presentations from you. So thank you very much. I appreciate it. That's all for the questions from me. I'll let you enjoy the rest of your Saturday, and I appreciate it. And thank you again very much.
Thank you.
Mm-hmm.
Have a great weekend. We'll see you later.